Hello, I am Dr. Chandrika HS, practicing as an obstetrician and gynecologist at Chirag Hospital, P Nagar 2nd Phase. Well, being in 50s and getting your periods, it is a natural thing. See, what is the thing is, this phase is called as perimenopause. See, when you are going towards menopause, but you have not attained menopause, that is called as perimenopausal period. So, during 50s, if you are getting your periods, it may be natural and nothing to worry. So, only thing is, because the function of the ovaries will be waning, that is coming down. Because of that, the periods will become irregular. And one more thing I want to stress in this is the incidence of malignancies has increased now. Cancer has increased in the whole society. So you have to be careful about this, whether you are going for uterine cancer. So for that sake, you have to be wary that if you have not had your periods for a very long time and again you get your periods, you have to meet your gynecologist. What is the reason is the layer that sheds every month during menstruation should not go too much. That is, thickness of that layer should not increase too much, because if it increases too much, it may be just a hormonal change and delayed periods. But more than that, if the thickness is more, it can be a malignancy of the uterus, that is endometrial cancer. So if you are not getting your periods regularly, just wait and watch. And if you get your periods once in 1.5 months to 2 months, it doesn't matter. But if it crosses 2 months, it is better to get your periods. So if you are not getting, you meet your gynecologist, so she will take care of your problem. So irregular periods is one thing, and one more thing is menopause. Nowadays, as I told you earlier, the status of the Indian women has increased nutritionally, because in olden days, when we used to be children, the menopause used to happen at a very younger age because of the malnutrition that most of the mothers used to face. That is the reason most of the mothers used to have menopause at 40. But though that age has drastically changed now. Nowadays, our Indian mothers or our Indian women are on par with the Western women. So most of the ladies have menopause at a later stage. Means most of them may have menopause around 53, 54, 55. That is a change, major change that has happened in today's society. So that is the reason. So if your periods are irregular, as I told you, you watch for some time, and if it is happening once in a way around 2 months or 3 months, doesn't matter. But once, it is better to meet your gynecologist and to find out whether you have any problem, so that you should not go into dangerous things like uterine malignancy. Perimenopause is nothing but near menopause. See, suppose you are attaining menopause at a particular age, around 8 to 10 years before that age, that is when you call it as perimenopause. And after menopause, around menopause also, it can be called as perimenopause. So there are so many problems that can happen in this perimenopausal period. So what are the things? One thing is, that's what if you are having irregular periods, that is the indication that it is a perimenopause, and that is the time so many ladies will develop thyroid problem also. Older age women are known to start having hypothyroidism in this particular period. So if you have any of these problems, as a routine, as a educated lady, it is better go to your doctor, and it is better you take one thyroid test also, because you will suddenly develop hypothyroidism. And if it's hypothyroidism, it is a very simple substitute for thyroid, sub-functioning of the thyroid, which can correct it, and you will not fall into problem. Because what is the thing I want you to know is, hypothyroidism is a stage when, because of the reduced production of the thyroid hormones, you will become obese. And you, without your knowledge, you will think something is there and I become obese. And you will just, somebody will tell you that you are hypothyroid, so you are obese. But don't take that as a reason for your obesity. Because when you neglect your obesity, if it is very early stage, you can prevent it or you can correct it. And you neglect it, and if it goes to a very bad stage, the obesity will be so gross that to come back to normal physique, it will be a very difficult situation. So that is one most important thing I would tell you about perimenopause. And one more thing is menopause. Menopause is called as menopause when a lady stops menstruating for a period of 1 year. So if you have stopped menstruating for 1 year, and if you have crossed that 1 year, that means you are a post-menopausal lady. So post-menopausal, one of the commonest things we have seen is hypothyroidism that happens in ladies. And one more thing is, as age comes, because of your age, increase in age, you will always develop morbidities like obesity, and because of obesity you will develop cardiac problems, and you can develop other routine problems like fatigue and all those things. So because of that, in this period you have to be careful about your health, so that any problem you have, you meet your doctor, so that if it is needing a routine physician, she will refer you to a physician. Otherwise, if it is a gynec problem, she will handle it herself. Irregularities means it is a menstrual irregularities, I suppose. So menstrual irregularities, as I told you, because of the waning hormone levels of the ovaries, the frequency of the menstruation will reduce. So you will have less number of times. It means what you are having every 28 days when you are younger, it will slowly become 30 days. And after becoming 30 days, it can become 35 days. It can become 40 days. And sometimes as age advances, it can become 1.5 months and 2 months, etc. etc. So the number of cycles that you will have become more infrequent. That is one thing. And second thing is, because of the waning hormone levels, the amount of bleeding that you have also will start reducing, because you will start having less amount of bleeding. And sometimes because of the irregular hormone changes and irregular growth of the endometrial lining, you may sometimes have heavy bleeding also. Because one of the commonest things, that is a common analysis, is suppose you don't have periods for a long time, that is say 2 months, and then you have your periods. That means the lining that used to shed every month has grown to the extra level, and so when it sheds, it will be more heavy. So that is one reason that you will have more heavy periods in the perimenopausal region. And that time, because of the heavy bleeding, you may lose unnecessary amount of blood, and this will again lead to anemia. And if you have anemia, you will have more of fatigue and more inability to do your routine activity, and more mentally also you will become exhausted. So those are the things that you have to take care. When you have these problems, it is better you meet your doctor. No, fibroid and thyroid cannot be mistaken for perimenopause. Fibroid is one thing which can start in any age. Nowadays, very young people also are having fibroids. Maybe about 15-20 years back, fibroid was not as common as it is that we see in the society nowadays. So, it is not that because of perimenopause you will get your fibroids. There will be already seedling fibroids which will be slowly growing. And what happens during perimenopause is, it will be actually a gift for you, because in perimenopause the hormone level will reduce. So, if you are already having a fibroid, the hormone secretion will reduce, that is estrogen, progesterone will reduce, and this hormone is also needed for the well-being of the fibroid, that is the growth of the fibroid. So if you are reaching menopause, the chances are that the fibroid will not grow more, it will not, or it may start sinking when you attain menopause. This is the advantage. Whereas, as I told you about thyroid problem, we have seen that during menopause, that is the time when many ladies will go in for hypothyroidism. That is one thing you have to be careful about menopause. I told you, perimenopause or menopausal stage, you have to track your cycle. You have to see how irregular it is becoming. See, what is the thing is, associated with the irregular cycles, you will have many more problems because of the reduction in the hormones. That this is one thing which is easy to observe, that is whether bleeding happens or not. But more than that, because of the deficiency of hormones, you may start having what is called as hot flushes, night sweats, sleep disturbances, depression. These are all very difficult for the ladies to handle, and that is what I tell the partners, to be wary of that situation, and you have to be cooperative with her. You have to cooperate, and you have to look after her moods and all those things, and you have to help her to come out of that. See, these are the things which can be handled to a certain extent by your own efforts, and sometimes it needs real help, because it may need help in the form of hormone replacement. And hormone replacement is not such an easy thing, because once you put hormones, it can have more adverse effects. Example is, nowadays you have more common incidence of breast cancers. So there are some breast cancers which depends on hormones. So if you can't just simply replace hormones and make her feel good. So you have to see what are the dangers and what are the advantages, and depending on that you have to help treating the menopausal lady in getting over her problems.